Your brain is actually two brains, two hemispheres, each performing half the work that makes you who you are. Half of what you see goes to each hemisphere, and half of your movements are controlled by each one. The right hemisphere controls the left side of your body, while the left controls the right side. These two brains coordinate through a bundle of nerves which, in some cases, can be cut. This procedure was once used as a treatment for epilepsy, and people seemed the same even with their brains divided. Epilepsy is a chronic neurological disorder characterized by recurrent seizures, which are episodes of abnormal electrical activity in the brain. These seizures vary in intensity and type, from brief lapses of attention or muscle contractions to prolonged severe convulsions affecting the entire body. Epilepsy can be caused by various factors, including brain injuries, genetics, infections, or metabolic disorders, and it affects people of all ages. Treatment generally includes anticonvulsant medications and, in some cases, surgery. However, some split-brain patients notice that while choosing their morning clothes with one hand, the other hand might disagree. In fact, the left hand would often oppose, which was frustrating for them. What's happening here? To understand this, it's essential to remember how each cerebral hemisphere operates in distinct yet complementary ways. I'm about to explain this in depth, but stay until the end as I'll mention a list of mental exercises you can do daily for each hemisphere, helping to reduce the risk of neurological conditions like Alzheimer's and dementia. The right and left hemispheres act almost like two separate entities, each with its own domain over perception and control. However, there's a key difference that creates the greatest divide: language. The left hemisphere not only controls the right side of the body, but also houses the language center, responsible for speaking, reading, and comprehension. Broca's area, typically in the left hemisphere, is primarily associated with language production. Located in the posterior part of the inferior frontal gyrus in most people. For some, like left-handers, Broca's area and related regions may be in the right hemisphere or shared between both, though this is less common. Wernicke's area, similar to Broca's, is usually located in the left brain hemisphere, specifically in the posterior temporal lobe, and is vital for understanding language, enabling comprehension of both spoken and written words. When you communicate, saying a hello, it's your left hemisphere turning thoughts into articulated words. In contrast, the right hemisphere, equally crucial, lacks access to this language center and is silent. Yet it remains highly active in cognition and perception. People with injuries in these areas due to trauma, bleeding, or ischemia experience changes in how they understand or communicate. For example, Broca's and Wernicke's aphasias are language disorders from damage to specific brain regions. Broca's aphasia occurs when the Broca area in the left frontal lobe is damaged, leading to slow, fragmented speech, though comprehension remains. Wernicke's aphasia affects language comprehension, making speech fluent but incoherent. In a brain with no alterations, like a surgical division, this language skill difference usually poses no issue. Both hemispheres are connected by the thick nerve fiber bundle called the corpus callosum, which constantly relays information. This bridge allows the right hemisphere to share its perceptions and emotions with the left, enabling verbal expression. But when the corpus callosum is severed in a procedure called callosotomy, sometimes performed for severe epilepsy, Information flow between hemispheres is drastically reduced. The two hemispheres previously working in harmony now function almost independently, revealing unique traits of a divided brain. Unfortunately, as a species, it has taken medical treatments to deepen our understanding of the human body. For example, in the 1980s, the patient IB, who suffered intractable epilepsy since childhood, underwent a full callosotomy. Despite ethical concerns, the family chose surgery due to IB's poor quality of life. After the operation, seizures decreased, but unexpected side effects appeared. IB developed what neurologists call alien hand syndrome, where his left hand, controlled by the right hemisphere, acted independently, sometimes against his conscious will. This led to frustrating situations, like attempting to button a shirt with one hand, only for the other to undo it. This case emphasized the profound effects of hemisphere disconnection and how each hemisphere could, in a way, act autonomously. Split brain studies in monkeys by Nobel laureate neuroscientist Roger Sperry were foundational in understanding brain specialization. In the 1960s, Sperry performed callosotomies on monkeys to observe how disconnecting the corpus callosum affected coordination. Post-surgery, monkeys exhibited behavior remarkably similar to that of human split-brain patients, such as failing tasks requiring cross-hemisphere coordination. These experiments were crucial for understanding brain compartmentalization, laying the groundwork for later human studies. These cases highlight the importance of callosotomy in epilepsy research and our understanding of brain division, providing insights into brain function in humans and animals, advancing our knowledge of the brain. Imagine a scenario where the two halves of the brain operate independently from one another. Let's consider some experiments. If you place an object in the left hand of a person with a split brain and ask, "What are you holding?" the left hemisphere, which handles language, will honestly say, "Nothing." This isn't confusion. Due to the lack of communication between hemispheres, the left side simply lacks access to the sensory information that the right hemisphere has. They are almost functioning in parallel, each in its own bubble of perception. However, the right hemisphere knows perfectly well what's in the hand but can't verbalize it. If you ask the person to manipulate the object with their left hand, they will do it skillfully, unaware of what is happening. This situation is already fascinating on its own, but it becomes even more intriguing when you introduce a creative task. If you give them a piece of paper and ask them to draw with both hands, something extraordinary happens. The right and left hemispheres start drawing independently, almost like two different people working on the same paper. The left might draw a triangle while the right draws a circle, each hand following its hemisphere's instructions without interference or coordination. For a person with a typical brain, performing such a task would be extremely challenging, as the hemispheres usually work in harmony, creating a unified effort. These experiments reveal something unsettling about the nature of consciousness and identity, suggesting that within each of us, even those with intact brains, there could be two separate intelligences coexisting. For split-brain patients, this separation becomes tangible. The existence of a silent intelligence hidden within the skull raises fundamental questions about the unity of self, even within one's own mind. When the brain is split, a perplexing dilemma arises. Who are you when the one synchronized brain hemispheres separate? Questions about thoughts and feelings can yield contradictory answers from a person with a split brain. If asked how they feel, the left hemisphere might provide a coherent, logical explanation. But does this narrative truly reflect the person's experience? The right hemisphere, though unable to speak, actively participates in perception and world interpretation. It can listen to questions, and even if it cannot verbalize a response, its understanding is reflected in actions, gestures, and decisions. This hemisphere, the other self within the speaking mind, has its own preferences, memories, and opinions. Consider facial recognition. The right hemisphere innately recognizes faces, identifying familiar people in a crowd. If you relied solely on the left hemisphere, you might find yourself lost in a crowd, unable to distinguish loved ones from strangers. This fact highlights an uncomfortable truth. The speaking hemisphere, which builds narratives and makes sense of the world through language, doesn't have access to all the capabilities that define who you are. Part of your identity, your skills, and your ability to connect with others resides in the silent right hemisphere, which understands far more than it can express. Splitting the brain in two reveals disturbingly that the mind is not a single unit. Perhaps the split doesn't create a separate intelligence in the right hemisphere, but instead reveals that it has always been one. In normal people, the right hemisphere might have started as an equal partner until language developed, relegating it to silently coordinate with the left hemisphere. Right now, inside your intact brain, there are two versions of you watching this video. One surprised, the other possibly bored by the obvious. In split brains, the right hemisphere isn't disturbed because little has changed for it. You might disagree, perhaps debating how this isn't possible, exactly as we'd expect the speaking left hemisphere to argue. Aside from speculation, split brain patients show that there is something separate within the mind that can listen, understand, and respond under the right circumstances. Your brain is not entirely yours. Who are you? You are too. Mental exercise. Cross-coordination. Objective: activate both brain hemispheres through cross-body movements to synchronize body and brain. Instructions: sit or stand with a straight back and feet flat. Take 3 deep breaths to center yourself. Exercise 1. Left hand, right eye. Close your right eye and, with your left hand, touch your right shoulder. Then, stretch your left arm straight forward. Exercise 2. Right hand, left eye. Open your right eye, close your left eye, touch your left shoulder with your right hand, and stretch your right arm forward. Alternate rapidly between these two movements, touching shoulders and extending arms, while switching the closed eye for 30 seconds. Additional challenge: count backward from 20 out loud or mentally as you perform the movements. This adds a verbal component that further challenges coordination between both hemispheres. Exercise: alternate drawing and writing. Objective: activate and coordinate both brain hemispheres through alternating visual and verbal tasks. Preparation: sit with a straight back, place a piece of paper and a pencil in front of you, and take 3 deep breaths to focus. Exercise: left hand, drawing. Use your left or non-dominant hand to draw a simple shape, like a circle or triangle. Focus on form and movement. Right hand, writing. Simultaneously, with your right or dominant hand, write a letter or simple word, while continuing to draw with the other hand. Switch shapes and letters every 10 seconds. For example, if you start with a circle and the letter A, next, draw a square and write the letter B. Challenge. Increase the speed of switching between shapes and letters, trying to keep both movements synchronized without losing drawing or writing quality for 1 minute. The comment that reaches 1000 likes will define the next video topic. Remember to like and share.